I have a number of questions. I'll try to keep them short, and I'd appreciate if you could keep your answers short as well, if possible. In response to Deputy O'Dowd, who pointed out that 22% of nursing homes were not HICWA compliant, you pointed out that there's a power to seek deregistration in the courts. But in the meantime, is it correct to say that the HSE are still funding those nursing homes through the Fair Deal, through the National Treatment Purchase Fund, etc.? And if so, is that satisfactory, or are there any plans to change that arrangement?
So, Chair, there isn't a direct link. I mean, the key to enabling the HSE to pay in respect of care is that the nursing home would be registered. And as long as it's registered, then there is...
And if it's registered and failing, you continue to pay them?
Well...
yes.
Well, I suppose if we cease to pay, then care would cease. So HICWA go through a process of trying to improve standards within the home through their mechanisms.
Do you pay for new patients in nursing homes which are not HICWA compliant and are failing infection guidelines?
So I'm not sure if there are many nursing homes that are 100% compliant. I'm sure there are.
And are failing. Do you pay for new patients going into these?
If someone is approved under the nursing home support scheme and the nursing home is a registered nursing home, unless there is some impediment put in place through a condition of registration by HICWA, then the HSE is obliged.
So merely failing in infection control is not an impediment. Thank you. You mentioned discharge, and you said that individual clinicians were discharging people who were inappropriately in acute hospitals. Can you confirm that only people who were inappropriately in acute hospitals were being discharged? Mr. Walsh, you were the person who mentioned about inappropriate people who were inappropriately in hospital were discharged.
I'm not sure what that reference was to, Deputy, but I think I referenced earlier about discharge of people from acute hospitals when it was deemed when their journey of clinical care was finished in acute hospitals. As happens well before COVID, patients are discharged once the clinician managing their care feel they no longer need to be in an acute hospital. And as I referenced earlier, at that time, throughout March, there was an acute awareness of the impact COVID-19 was having on acute hospitals in other countries.
I get all of that. My question was, is it only people who were inappropriately in acute hospitals whose treatment had been completed, their planned treatment had been completed, were discharged? Can you confirm that or not?
No, I don't know, not at all. It's anyone whose course of treatment has finished.
But was it only people whose course of treatment had finished were discharged?
Yes, well, that's always been the way, that they either go home,
okay, thank you,
or they go back to where they came from. Which might.
Can I just ask, how many people on any given day, and you may or may not know this, are still in acute hospitals even though their course of treatment has completed or has finished?
Chair, the current figure for people who have completed their treatment and are awaiting an onward placement is in around 400.
So there are 400 people taking up beds in acute hospitals whose treatment is complete, and they're just basically waiting for somewhere else to go. They're not there for any other reason other than they've no place else to go, even at these times of COVID.
I think where people are listed for long-term care or for assistance at home for home support, then sometimes they may become unwell again, and so there may be an impediment to them moving. But at any one time,
400.
The time lag between been.
Thank you, Mr. Walsh. 400, I think, is the answer you've given. I appreciate that. You mentioned international comparators, and we needed to be able to free up our acute hospitals. We didn't know what was coming at us. Everybody accepts that. One of the things that was pointed to at the time was that there was a lack of ventilators in Ireland. How many ventilators have been bought since the 1st of March?
Deputy, we had an initial stock in total across all our system of about 1,100, and we aimed to double that stock by another 1,100. However, later into the stage, we stopped the procurement, so it was about an extra 700
ventilators. Thanks. Deputy Burke pointed out that 56% of nursing homes had no incidence of COVID. which is obviously good news. Does anybody look at why that was, and in particular whether there's any correlation between that 56% and nursing homes that didn't receive discharges from acute hospitals?
The biggest single correlation we've seen so far, and bear in mind we're still at the early stages of pandemic, is the level of community transmission. Where there are high levels of community transmission.
Well, my question is, I heard that and I appreciate that answer, but did you look at whether there's a correlation between the 56% of nursing homes that had no incidence of COVID and those nursing homes that did not receive discharges from acute hospitals?
A range of correlations have been looked at so far. We're still in the middle of analysing this.
Has that correlation been looked at?
No such correlation has yet been shown. As I said, the most significant level of correlation is with community transmission.
I know, that I understand. Have you specifically looked at the link between the 56%, whether there's a link between the 56% of nursing homes where there's no incidence and the number of nursing homes where there was no discharges from acute hospitals?
Study of that nature,
not yet.
Looking at single correlate hasn't been carried out, to my knowledge.
That hasn't been looked at? That has or has not been looked at?
Not at this stage, no.
Sorry?
Not at this stage, Deputy.
Not at this stage, thank you. Media reports suggest that the 10 worst affected nursing homes were, there were 240 deaths in those 10 worst affected nursing homes. Is that correct? And were those 10 worst affected nursing homes on the list of nursing homes that HIQA sent to you with expressing their concerns about them?
So, I suppose, Chair, I have two separate streams of communication from HIQA, one in relation to HSE or Section 38 homes, and then on a daily basis since the beginning of April, I have received updated lists from HIQA in relation to the totality of registered nursing homes, public or private. I think what's clear from looking at those lists is, as Dr. Henry has said already, there isn't a direct correlation between.
Sorry, the question was more specific. It was HIQA sent you a list, or at least they told us they sent you a list of nursing homes that they had specific concerns about in the context of COVID-19. Is it correct that in the 10 worst affected nursing homes there were 240 deaths? Is that or is that not a correct report which was in the media? And secondly, were those 10 nursing homes on the list of nursing homes sent to you by HIQA who were concerned about a number of specific nursing homes?
Deputy, in relation to the HSE or Section 38 nursing homes that were notified to me, a significant number of those had no deaths whatsoever. Some of them did have significant numbers of deaths. They were not the highest deaths. In relation to the private nursing homes, and I think it's important to say that the data that was published was not validated data in terms of confirmed deaths from COVID. But once again, there is not a direct correlation between the nursing homes that HIQA would have had most concern about and those nursing homes with the highest numbers of RIPs.
Thank you very much, Mr. Walsh. Mr. Breslin, you talked about resuming visits to nursing homes. I heard in Morning Ireland on Monday, I think it was, or perhaps Tuesday, that there was a suggestion that people would visit their loved ones in nursing homes through a Perspex screen. Is that actually happening, and is that satisfactory to the Department of Health and the HSE?
So there is Colm Henry might talk to this, there is a set of precautions that are in place at the moment to facilitate visits. And
through the Perspex screen?
Deputy, yes, we've advised nursing homes on resumption of visiting, and the advice pertains not to Perspex but to the number of visitors and the time they can spend with their relative in nursing home settings. And as was cited by one of the earlier deputies, this is a really important, if not critical, component of their care, and the isolation has been, to say the least, damaging for people.
Thank you. So there are no Perspex screens then, is that what I'm hearing?
The advice didn't specifically refer to that's possibly one introduction some nursing homes may introduce, but the advice given was in terms of distancing, number of visitors, and time spent with the resident. So if nursing homes choose for whatever reason
As somebody who has taken legal instructions from people through screens in prisons and visited a loved one for a considerable period of time in a nursing home, could I just say that I personally would have concerns about perspex.
Dr. McClellan might just...
But I do fully accept that precautions have to be taken. Just perspex screens seem to me to be dehumanising somewhat.
Excuse me, Chair, Dr. McClellan was just going to add something.
Thank you. Thank you, Dr. McLennan.
I was just going to add, the visiting guidance here is very much around the fact that the person in charge would plan visits, that where social distancing can't be maintained, that visitors will be required to wear a surgical mask. So it's only where social distancing can't be maintained, and that the facility themselves will provide that mask. The visits should occur in the resident's room, if the room is a single room, or if it's a multi-occupancy room, that would be a room.
Thank you, and that I think it's noteworthy is entirely compliant with WHO guidelines. Thank you. You mentioned, Mr. Breslin, that you're looking at RIP.ie for excess debts. Given that the Oireachtas beefed up the power of the Registrar of Deaths, Births and Marriages, why are you looking at RIP.ie data rather than data from the Births, Deaths and Marriages, the Register of Deaths?
So the legislation on the registration of debts in this country allows a 3-month period for a debt to be registered, and in normal times that's probably fine, although that does lead a lag for that information being available. But in the context of a pandemic where you want as up-to-date information as possible, that's quite a lag. Some other countries, for example Northern Ireland, it's 5 days to register the debt.
Thank you.
We are in discussions with other departments on that, but to get around that issue, a full analysis has been done on RIP.ie, and it's a very close approximation of the total number of deaths.
Thank you, Mr. Breslin. 2 last questions, and I do appreciate your forbearance. You mentioned that the expert report that's being led by Professor Kelleher, we're obviously as a committee hoping to look at that. When do you expect that report?
So the ministers asked that they would come back by the end of June. They are independent, so they'll try and work to that. I haven't got a confirmation that they'll meet that exactly, but that's our wish, that they would complete by the end of June.
And then my last question doesn't relate to nursing homes, but it was in the media today. It's that there are seem to be good results coming from the use of the steroid dexamethasone, which is not a particularly expensive one, but it's not yet used in Ireland. Can anybody explain why, or what are the plans around that?
This drug is widely used in Ireland for other reasons. These are early trial results on a very select number of patients who are high ventilatory support and highly dependent. So we've sent an alert out to our own clinical community, and as with any other drug that is licensed and available, it will be based on individual clinical judgment in the appropriate critical care settings.
Thank you very much. I've gone over time. I thank you very much for answering all of the questions and for your patience and forbearance. Thank you.
Homes which are COVID-free, can we have the numbers of patients transferred to those 56%?
Yeah, can we get the number of patients? Yeah, that's a very reasonable request by Deputy Burke. Can we get the 56% of nursing homes that were COVID-free, can we get the exact number of patients that were transferred into those nursing homes?
Brilliant.
If possible, by correspondence, maybe within 10 days. Is that a reasonable period? 10 working days? And again, I would thank you very much. I would now like to suspend the committee until 2 o'clock this afternoon. Thank you all very much. Thank you.